What I wanted to share with you today is a little bit of my own journey and the things that I've been able to be a part of. I think at this stage, I used to joke about people in their 30s writing memoirs, right? And I would say, how can you write a memoir, in your 30s? And so I said, you have to wait to do that. And so now that Medicare cares more about my birthday than I do, it's time to write a memoir, right? But the challenge is you've probably forgotten all those things you should have written about. So I applaud the young people that have the courage to write memoirs early. But the point that I want to make is that there are some critical lessons that I've learned over the years and the decades, and I want to share some of those with you today as it relates to before the bow breaks. I love that because, the segment of unnatural causes is when the bow breaks. And the segment that focuses on infant mortality and infant mortality disparities, we were very lucky to be able to be an advisor to that film as well as a funder. And so when I saw your title, I knew the focus was on prevention. What can we do, not just to prevent infant mortality, because I believe the thing we focus on is what becomes real, right? What can we do to optimize birth outcomes? That's a different frame than preventing low birth weight and infant mortality. So one of the lessons I would like to share today is we really need to reframe our context and figure out what are we doing to optimize birth outcomes. And that opens the door to the discussion of the life course perspective, the social determinants, and all of those things that you've heard today. What we want to do is make sure that every child is born fully developed and that they're born into a family and a community where the love is there to optimize their development. Many years ago, I watched in my neighborhood in Cleveland, Ohio, and some of you, anybody here from Ohio? They have the distinction of having some of the worst birth outcomes in the country, indeed in the world, and Cuyahoga County in particular. And I grew up in Cleveland, Ohio, and I remember my mother had a best friend. It was a couple, my mother and father's best friends, and they had one daughter. And that daughter got married to a military man, and she went off to a military base in Texas. And we received a phone call one morning saying that the mother and the child had died in childbirth. And I remember that the couple never recovered. The parents never recovered. This was their only daughter, right? And the friendship dissipated because life changed dramatically. And then there was this family that I was very close to. The family had 7 children, and all of the children were named after the father, even though they were all girls. And so there were different iterations of Roberta and, Bobby and Robbie and, and so forth. And then finally, the mother was expecting and was going to have a boy, we think. I think that was the story. But at any rate, we did receive a call saying that she had died in childbirth, but the baby had lived. And then fast forward a few years, I get married. I'm having my first pregnancy and my first child, and at about 3 months of age, my firstborn, whose name was Intianu, which means noble spirit, Intianu died. She left us. And I remember what that did to me as a mother. And so this concept of infant mortality, it is really trauma and loss in the lives of real people and real families. And I do believe it was the loss of Intianu that set me on my course in life. It was in seeking help for her early on that I discovered my profession. And even today, my healing center in Washington, D.C. is named in her honor. And so these losses, this issue, infant mortality has a way of being a bit sterile and cold. It's an academic concept. But the loss of a child is a devastating human and personal experience. And we can do more. We can do so much more to stop that. So I went off, I became a holistic doctor, a naturopath, a napropath, a clinical nutritionist, and I went on to give birth to 2 other children who are very healthy adults today. In fact, I had the privilege this morning of going to hear my daughter give a keynote address at the Omni Showroom. So yes, life is good and life is fair. But I never lost, and they view Intiano as their sister, and we never lost our appreciation and reverence for the gift of life. So my career moved from being in clinical practice on the south side of Chicago to designing social programs on the south side of Chicago, to moving to Washington to work on health policy, to going to Harvard to work on innovative approaches in government, back to DC with the Joint Center for Political and Economic Studies, where we launched in 2004 or 5 the Commission on Infant Mortality, which was called The Courage to Love. And Dr. Liu was on that commission, and Jim Collins was on that commission. And I want to talk to you. I heard someone today ask about, or it was a woman from Africa, and she was talking about how different her experience was than from African Americans. And Dr. Collins' work, and you can Google him, James Collins, he has actually studied the difference between the birth outcome experience of immigrants from Africa and the birth outcome experiences of African American women in this country. And it helped to show that there was a dramatic difference, and there is something toxic in the environment in this country of racism. When we look at the disparities that are racially based, African American, Alaska Native, Native Hawaiian, Native American, African American, we see that this issue, and the issue is really, you know, people keep talking about we need a conversation about race. I would suggest to you that the issue is the belief in a hierarchy of human value. Now, that's another way of saying racism. However, the emphasis has to be on the belief. Beliefs have power. Beliefs shape our experiences. And in America, we built this nation on a bedrock, on a fundamental belief in a hierarchy of human value. Now, the belief had its origins back in the 18th century, when taxonomies were being created for all manner of animals and plants, and we still live with many of those taxonomies. A botanist, a Swedish botanist, Linnaeus, created those taxonomies, but he also offered one of the human family. The irony is that that particular taxonomy was created about the same time the printing press proliferated. And so this world that we know of today, when we were going to school, they called it the New World. It was built on this fundamental premise, this false premise of a hierarchy of human value. Characteristics and intellectual capabilities and all manner of attributes and distinctions were given to these groups along this hierarchy. And it wasn't until the turn of the century, this century, that the human genome helped us to know that that's all crap. That we are 99.9% the same. That there's more difference within the so-called races than there is between the races. And yet we have built a society grounded in that fundamental fallacy. And even though we've had a civil war and we've had a civil rights movement, I would suggest to you that we have never dealt with that fundamental problem of a belief system that is contrary to everything we espouse about being a democracy. And so when we see infant mortality, when we see health disparities, when we see disparities in incarceration, when we see wide gaps in disparities in income, and I made a promise to myself that I would never put up another slide that reiterated those disparities, because there are too many of those. If I show you a slide, it's going to be about the way forward. But these things are symptoms of the deeper underlying challenge that we have. Now, the irony is this fallacy of a hierarchy of human value, it was perpetuated during the time of the biggest information revolution those centuries knew. So not only did we have the revolution of the printing press, we had the revolution of this idea of taxonomies, right? But we're blessed to live in an era of an information revolution, the likes of which we could never have imagined. The Twitter and the Facebook and the Instagram. I'm pretty good today. 2 weeks ago, I couldn't have named all those things. And I certainly don't use them. But I know that they're there. And I know that they are shaping consciousness and they are shaping communication. And our challenge is to build on today's information revolution to transform our relationships with one another away from the biases that are embedded in our society toward an understanding of our relationships as one human family. That is our work in the 21st century. And if we do that in America, we will truly be a shining light to the rest of the world. Now, my career took me to philanthropy, and the reason I left my comfortable place in Washington, D.C. at the Joint Center for Political and Economic Studies was because the board of directors of the Kellogg Foundation, and it's very important that there be an authorizing environment, the board of directors made a decision to become the most effective anti-racist organization they could be. And when I read that the fifth largest philanthropy in the world was willing to make that stand, I said, sign me up, I had to be there. And so I did, and you know your life is out of order when the TSA workers are the people that miss you in the world. Because what I've done for the last decade is commute to Battle Creek, Michigan every week and back home to Washington at the end of the week. And so when I show up at the airport, the TSA workers say, "Where have you been? We haven't seen you for 2 weeks, But we have invested in that time period well over $200 million in communities all over this country to not only address the healing and the belief in the hierarchy of human value, but also the structural manifestations of that, one of which is the poor birth outcomes of people of color in this country. So, a lesson that we learned was that we had to put real resources into innovation in improving birth outcomes. And it's ironic, I'll share a couple of components of our approach. We have reviewed the literature and we really understand the primacy of relationship. So we put money into models like centering pregnancy. We have found that being in small groups, getting support from the doulas, we funded work on doulas, we funded work on companion care at the point of delivery. We understand that one of the ways we mitigate the stress of exposure to isolation, to rejection, to discrimination, to abandonment, single mothers. Most single mothers are abandoned mothers. No one grew up and said, when I grow up, I'm going to be a single mom. I don't think that's the way that worked. Most people entered into a loving experience thinking that it was a committed experience, most. And then they find themselves having to do this or go this alone. And so when you can mitigate some of the consequences of that isolation by providing loving companionship, the research is there. You get better birth outcomes. Why, the Cochrane study, even when the companionship is only in the hospital at the time of birth, you get better birth outcomes. So what is this power, this magic of relationships? Some people say it has to do with oxytocin. And we know where else we find out about oxytocin, right? In the breastfeeding experience. Some people call oxytocin the moral molecule because it's the molecule of bonding. It's the molecule of connecting. And we have found that when we provide support, not only in the birthing experience, but also in communities and small groups who are trying to overcome their hidden biases. Nobody in this room is a racist. And there's another phenomenon that we've learned about, which is called racial anxiety. Now, white people in the room, you probably suffer from racial anxiety. And that is that you are so concerned about being part of this horrible thing called racism that you may overcompensate for that concern. You may freeze when you face it. You may run away from it. Racial anxiety is a very real phenomenon in America, and of course it is. But there are ways to deal with that once we name it. Just as unconscious bias is a real phenomenon in our society. But there are ways to deal with that once we face it. What I'm suggesting is that because our country was built on the fallacy of a hierarchy of human value, what we have done is to create a problem that the 21st century demands that we solve. Why is it so essential that we solve this today? Because most of the children born in this world, in this country, today, are children of color. And so the very future, the economic viability of America depends on us dealing with this relic of the 18th century. So we understand that the relationship is central to improving birth outcomes and finding every possible way to optimize connectedness. Jermaine Bond, Dr. Bond, I'm very much in support of your work on fatherhood and on the health of black men and on the mental health of black men, because we need that connection in order to be able to have optimal birth outcomes. But we also have to deal with the biases of the providers and the practitioners, and you cannot grow up in America and not have bias. So you can imagine, after losing my firstborn, how protective I was of my second pregnancy. And I was afraid of hospitals because I decided the hospitals really didn't care. And so I sought out the founder of the home birth movement. Beatrice Tucker was her name, and it was in Chicago, and she was an amazing doctor. And I was gonna have my baby at home with a physician and a doula, and everything was gonna be perfect, and there was gonna be no way that anything could go wrong. And lo and behold, the night I went into labor, Dr. Tucker was off delivering twins somewhere. So she said, "I'm sorry, I won't be able to get there." You can imagine, right? You have to go to the hospital. My associate will get there and take care of you. So I go to the hospital, I show up, this resident examines me, and then, I'm sort of off in a corner. And I sit in that corner in labor for almost maybe an hour or more. It seemed like forever. And then finally her associate shows up and he says, "I'm here for Dr. Tucker's patient. Where is she?" And the guy says, "She's over there." And he says, "What is she doing over there? Why isn't she being prepped? What is going on?" And the doctor looked him straight in the eye and said, "She's black." And I assumed she was on welfare. And if I were on welfare? The irony is that that baby was breech. So that decision not to either examine me properly or treat me properly could have cost the life of my second child, if not my own. Dr. Benarin went ballistic, of course. He read this resident, he made him re-examine me, which I could have done without, but he made him re-examine me. And discovered that, in fact, this was a breech presentation. And then all manner of energy was put into making sure that I had a healthy delivery. And I did. But this concept of being able to value some people more than others, trust me, it's real. And I encourage you to read a series that Women's E! News produced on birth outcomes and maternal outcomes for women in New York City, and the disparities are shocking. Not only the disparities in outcomes, but the disparities in treatment. So we push and fund efforts to offer training in institutions to overcome unconscious bias, to overcome racial anxiety, to just face this elephant in the room and get over it. That's very important, I believe, in improving birth outcomes. But the other area which I mentioned before, the research is so clear as to the power of breastfeeding. We have to create a new normal. We have to stand up against this industry, this formula industry, and we have to create a new normal for breastfeeding, not only for the optimal health of the babies, but we funded research that shows how it improves the mother's health. I mean, we're talking a reduced risk for cancer, all kinds of cancer, reduced risk for heart disease, reduced risk for diabetes, reduced risk for obesity. And there's a study coming out of Europe that says it's a reduced risk for retinal degeneration in women who breastfeed. Now, what I would like to see is the research that finds the mechanism as to why this act of nursing a baby is so protective. What are the biological mechanisms that are protecting the mother? But we're not even thinking about those questions, really. So that's an important, critical component of the work of optimizing birth outcomes. And we know that these low birth weight babies fare so much better when they have access to human milk from the beginning. And that should become the norm. I've been given the sign that I only have a few more minutes, so I want to talk with you a little bit about what's emerging that I find so fascinating. And Dr. Liu may have touched on it this morning when he talked about the cumulative effects of stress, because that's really what we're dealing with. You know, the social determinants, childhood adversity theory, life course theory, they're all coming together around this concept of how does the environment get under the skin and into the body and manifest in altered physiological responses. And there is this woman, Dr. Yehuda, who is doing research on the descendants of Holocaust survivors. Now, there is one other woman who's doing the same kind of research on the descendants of First Peoples in this country and the trauma that they have experienced. But what Dr. Yehuda's research has shown is that there's an altered physiology and biology around cortisol production, not in just the Holocaust survivors, but in their descendants. And that altered biochemistry and physiology not only includes the cortisol levels, but it also includes the enzymes that control the cortisol levels. So what does that mean? That means that the body, this amazing, intelligent, self-regulating, self-healing, self-maintaining organism, is always responding to our environment. And it is attempting to adapt at a cellular level so as to prepare us to survive. This is a new horizon of research. It fits with the epigenetic paradigm. But most importantly, it suggests to us that the way that we treat our adolescents and our childbearing age mothers and fathers is not only going to be important to them, it's going to be important to their children and to their children's children. It also offers a new mechanism for understanding why we see consistent disparities today in the ways that we do. There are two books, and Amazon, and I should own stock in Amazon, you know, because when I was a little girl growing up, I used to spend my weekends at the library all day on Saturdays. I see the sign, thank you. But now I just order the books, and they're there when I come home on Friday, you know, piled in front of my door. But there are two books that I find that I'm in love with right now. One of them is called Sick from Freedom, and it was published in 2015. It's the first time someone has examined the records of the Freedmen's Bureau and really chronicled the health challenges that African Americans faced both during slavery and post-Reconstruction. And it will just leave you speechless to think of the health challenges. Now, if we couple that with the research that's talking about multiple generational trauma and how it is affecting biochemistry, we perhaps have another way to look at the challenge we face when we continue to have a society that continues to traumatize generation after generation. Not all people. I mean, I am a woman of privilege. I grew up in a poor family, but there's been tremendous progress for many of us, probably for most of us in these rooms. But there's still a great deal of work to be done. And so once we understand the consequences of exposure to adversity and to stress and to environments that present barriers, we have to understand that in addition to changing those environments through policies and practices, we also have to provide the resources to mitigate the effects of those chronic exposures. Now, that's another workshop that I would love to give in a future year. In terms of what do we do to make sure that we don't continue to perpetuate the disparities and the biological adaptations that are there to stress. I will say to you that a key is in breastfeeding, because food is absolutely essential to optimal health, optimal life, optimal birth outcomes. And I coined the phrase for breastfeeding as first food, because that is the first model of optimal health and optimal well-being. So I believe that my time is up, but I want to say to you that we can do this. We can help families mitigate the reality of exposures, chronic exposures to discrimination and to the absurd notion of a hierarchy of human value. We can also find and identify and overcome our own biases. We can make sure our institutions have the resources to do the same, and we can hold our nation accountable for entering into a truth and reconciliation experience that is so long overdue for this country. Thank you very much.